This measurement is employed to assess the brain's well-being following an injury. Elevations in intracranial pressure can be attributed to a brain tumor, bleeding in the surrounding fluid, or inflammation within the brain. If not treated, an elevation in intracranial pressure can be a dangerous medical condition that may harm the brain or spinal cord due to the compression of brain structures and the limitation of blood flow to the brain. The symptoms of elevated intracranial pressure vary depending on the individual's age. In infants, these symptoms may include vomiting, drowsiness, and an outward bulging in the fontanelle. Elevated intracranial pressure in infants can indicate child abuse, specifically shaken baby syndrome or a separation of the bony plates that form the skull. Older children and adults may experience behavioral changes, headaches, lethargy, seizures, vomiting without nausea, decreased consciousness, and neurological abnormalities like abnormal eye movement, double vision, and numbness. Elevated intracranial pressure may occur alone or in conjunction with other conditions. Common causes encompass brain tumors, trauma, intracerebral hemorrhage, ischemic stroke, meningitis, hydrocephalus, intracranial hypertension, blocked airway, hypoventilation, seizures, drug-related interaction, posture, edema, and encephalitis. Elevated intracranial pressure is typically diagnosed in the emergency room or hospital. Early symptoms can be detected during a routine medical examination. Another indication of increased ICP is papilledema, the optic disc swelling that can be identified during an eye exam. A head CT scan or MRI may be conducted to confirm the diagnosis. Additionally, a lumbar puncture, also known as a spinal tap, can be performed to measure the pressure of the cerebrospinal fluid. Other potential causes of elevated intracranial pressure include brain tumors, trauma, intracerebral hemorrhage, ischemic stroke, meningitis, hydrocephalus, intracranial hypertension, blocked airway, hypoventilation, hypertension, seizures, drug-related interaction, posture-related issues, edema, and encephalitis. Elevated intracranial pressure is a severe and life-threatening medical emergency that requires treatment focused on reducing the pressure. Patients will receive care in the hospital's intensive care unit, ICU. The medical management of increased intracranial pressure includes sedation, cerebrospinal fluid drainage, breathing support, medically induced coma, hypothermia, and decompressive craniectomy. This condition is a frequent complication in critically ill patients. If treatment is delayed or the pressure is not reduced, it can result in temporary or permanent brain damage, long-term coma, or death. Matthew, a cancer and stroke patient whose Ph.D. was obtained at 65, asks you to help him raise awareness of health issues by sharing this valuable information. Please take the time to subscribe to and like this video.